The strain is really starting to show on the health system in New South Wales with this COVID outbreak. The Victorian figures are down slightly this morning, but there's still a concerning element, and the ACT exposure site list is growing. The challenges are still big, but that vaccination rollout is promising. We'll get you across it all and keep you updated with the media conferences later today on the COVID situation in Victoria, New South Wales and the ACT. We'll start in Victoria because the numbers are just through. Before we go to our reporter in Melbourne, let's take a quick look at the numbers. So case numbers slightly down this morning, but a continuing concern is those numbers that have been in the community while infectious, denoted there by the yellow portion of those bars. Reporter Eden Hennanen joins us now from Melbourne. Eden, g'day. So take us through these latest figures.
Yes, good morning, Joe. As you just mentioned, slightly down from yesterday's numbers. Victoria recorded 45 locally acquired cases over the past 24 hours. Now, 36 of those cases are linked to current outbreaks, but unfortunately only 17 of those were in isolation during their infectious period. But still, that headline number that we've been seeing over the past few days, today's 45, yesterday was 50 and the day before 71. So there is a downwards trend that we are seeing, but health authorities are still concerned about those mystery cases that we do continue seeing, and that's why we're seeing almost 770 exposure sites now listed across Victoria. They've been jumping by quite a bit daily, some by 100 per day. So that's also of concern. A couple of markets around the state, including the Queen Victoria Market and Epping Market, have been listed as tier sites. So health authorities are just really pushing again for more people to get vaccinated and help boost that vaccination number.
And where are you this morning?
Yeah, so I'm out at the Royal Exhibition Building here in Melbourne. It's been a bit of a chilly morning at one of the vaccination hubs across the state. And it's been some quite wonderful scenes here this morning, quite uplifting to see hundreds of people lining up to get vaccinated. The centre behind me here opened at 8 o'clock and there were more than 150 people lined up before that 8 o'clock open. And I must say, once it opened, everyone moved in quite quickly, and we've been speaking to people who've been getting the vaccine, saying that they went in, it was quite quick, and they've come out. And behind us here now, we're seeing quite long lines lining up again to come in and get the vaccine. Now, that's news from today, where Victorians have learnt that anyone over the age of 16 will now be able to get a COVID-19 vaccine at any of the state-run sites across the state. That means from yesterday, health authorities were saying that an additional 450,000 Pfizer vaccines will be coming across from Poland, and that anyone aged 16 to 17 can get their Pfizer vaccine. Those between 18 and 59 will be given the option to get the AstraZeneca or the Pfizer vaccine. Now, health authorities insisted yesterday that anyone that has previously booked in their AstraZeneca vaccine not to cancel if they do want their Pfizer. They said that if they arrive at their appointment, they will be offered both, depending on what they want to get. Now, those over the age of 60 will still rely on the AstraZeneca vaccine. But, Joe, some pretty promising signs here this morning, and it's great to see Victorians getting out and getting vaccinated.
I'm not absolutely rushing out to get it, but now they have the chance, it's definitely good to do my part.
Super excited because I just want to get back to normal life. Obviously, being locked down is not as fun for everyone. Just want to get back to normal business.
It's easy to be critical, but I think what's happened has happened, and let's just get everyone vaccinated from now.
As you can see there, Joe, Victorians really keen to just get the vaccination out of the way, boost these numbers in Victoria, and looking to do their part in this vaccine rollout.
Okay, Eden Hennanen reporting there from Melbourne. Let's head north to New South Wales now. A 30-year-old mother of three has died from COVID in Western Sydney. Her husband is one of the more than 600 people currently being treated in hospital. Before we go to our New South Wales reporter, a quick look at what's happened with the case numbers in New South Wales over the last couple of months. So there was a relatively big drop in numbers yesterday after 3 days up above 800, but we'll see what happens over the coming weeks. The yellow portions in these bars are cases confirmed to have been infectious while in the community. The red portions are cases where it had not been determined by the end of the day whether they'd been isolated or not, and there are hundreds and hundreds of those every day now. Reporter Lara Himes joins us now from Sydney. Lara, g'day. So more than 600 people in hospital now. How is the health system holding up?
Good morning, Joe. Well, it's really putting pressure on those COVID wards and also the other emergency services all throughout the state. We know that yesterday at about 5:30 or so, Westmead Hospital, which is a facility in Sydney's western suburbs, which does have a COVID ward and also an ER, sent around this letter to its staff members. Now, it said that to deal with the growing COVID cases and the additional pressures being put on its hospital, for the next 24 hours, it would be looking at reducing its critical care of patients that are coming into the facility. So that does include sending those patients to other areas within the network to be treated. And they're also willing to talk to the private sector to make about 100 beds come online to deal with the uptick and the increased pressure of looking to do those services. But it's not just Westmead that has really felt the brunt or been dealing with that. We also know that Nepean Hospital, which services the Blue Mountains, it's just located outside or within the Penrith catchment area, has also had huge pressures put on it, and also the Blacktown Hospital, also located in Sydney's west. In the last few days, those two hospitals have been dealing with severe ramping, and what that means is that patients have been waiting several hours in the car parks of those hospitals looking to be treated by healthcare professionals. So there has been some huge demand and just a lack of ability to be able to see those patients quickly. Sadly as well, we've also had that death, a woman aged in her 30s, Ineta Saka. She's a mother, she has 3 children. There have been tributes paid to her on Facebook. We do know that, as you mentioned, those case numbers have decreased in the last couple of days, but the warning that we've had from Dr. Kerry Chant, who's the Chief Health Officer, is that downward day doesn't indicate a trend. So hoping that the good news or the decrease in those figures continues today.
And what's happening with the vaccination rollout in New South Wales?
Well, we were set a target to reach 6 million doses of vaccine by the end of August. We seem to have done that with a week to spare. Now, the reward for people in New South Wales and Sydney in particular was going to be additional freedoms afforded to us. Now, it hasn't been outlined what those freedoms would actually be, whether or not it comes in the form of gatherings or maybe it comes in the form of businesses coming online. We also don't know if there's going to be additional restrictions or conditions put on those freedoms. So if it is in the case of business opening up, for example, it could require a person, a customer and a worker to perhaps be double vaccinated. Now, if that's the case, that may only service a small cohort of people, because we know in our vaccination rates, just over 60% have received their first dose and just over 30% have been double dose. So whether or not that announcement is going to service everybody immediately remains to be seen. We are likely to hear more on that as the week goes on, perhaps Thursday or Friday.
Okay, Lara Himes reporting there from Sydney. Sticking in New South Wales and going to the regions now, because there are hundreds of cases there. Today marks 2 weeks since Dubbo in the state's central west went into lockdown. Reporter Robin Heron is there and joins us now. Robin, g'day. So how's the community responding to the outbreak?
Morning, Joe. Yeah, it was 2 weeks today that we went into lockdown in Dubbo. Those first cases that we had were announced back then. Today we are day 5 into the vaccination hub that has been set up, the pop-up walk-in clinic. Now, it opened at 9 o'clock this morning. There's already well over 100 people in the building. There's well over 100 outside this building wrapping around this car park that I'm standing in as people are keen to get their vaccinations. So there are calls for this hub to be continued beyond the end of this week, because the demand for vaccinations is well and truly present in the Dubbo community.
Yeah, and a really striking number with these cases. Like, there are so many numbers floating around Australia at the moment with outbreaks and people in hospital and all sorts of things. But yeah, one thing that really stuck out for me this morning is that in Dubbo itself now more than 250 cases. Is that right?
Yeah, so we went from that initial cases that we were told 2 weeks ago was 2 cases in Dubbo, 1 in Walgett, and that's what prompted the lockdown in first Dubbo, then Walgett, then 6 other regional communities around us, and then by the end of that week the whole state was in lockdown. But we started off with 3 cases. 2 weeks later, more than 320 across the Western Local Health District. That's the whole northwest corner of the state. And yes, more than 250 of those in Dubbo. We're getting about, yesterday was 36 cases for the Western Local Health District. That's been fairly consistent, somewhere in the 20 to 30 cases every day that are being announced for this region.
And Robin, have you heard if there have been any people seriously ill there or pass away in that region?
I'm not aware of anyone dying from COVID-19 in this region, but we do know that a number of people are hospitalised. I think there's maybe 4 in ICU and 1 person on a ventilator. Those were the statistics yesterday. So there are people seriously sick in this community. The big concern as well is how it's affecting young people. We do know, as I mentioned to you yesterday, more than 40% of the cases in Dubbo are under the age of 20. So it's very much circulating within the region's teenagers and children, and very much has affected school communities and also the Aboriginal population in Dubbo as well.
And so there's some of the focuses for authorities right now?
Absolutely, the focus is to continue testing and vaccination. Such great news that everyone's turning out to these vaccination hubs that have been set up. And like I said, there are calls for it to hopefully be extended beyond this week. Vaccination hubs are happening in communities all throughout the Western Local Health District and also the Far West Local Health District. The other push really is for testing. There is still grave concern about the numbers of testing in areas like Burke, Bathurst, Orange, parks where there are known cases, and they just want more people testing to make sure that it's not circulating in the community.
OK, Robin Heron reporting there from Dubbo. OK, so we've covered Victoria and New South Wales. Let's head to the other area or jurisdiction of concern at the moment, the ACT, which saw its highest daily rise in cases yesterday. The latest figures show 30 new infections, bringing the total number of active cases in the outbreak to 167. 11 of those yesterday were infectious in the community, and the isolation status of 6 remains under investigation. And we'll have more from our reporter Lisa Glenday later this hour. Now, parents could be vaccinated against COVID alongside their children under plans being developed by the federal government. Political reporter Jade McMillan joins us now from Parliament House in Canberra. Jade, g'day. So the man in charge of the vaccine rollout has provided more detail on how vaccinating children will work.
Yeah, good morning, Joe. At this stage, there are still no plans to vaccinate children under the age of 12. But when it comes to those aged between 12 and 15, there are already some young Australians in that age group who are eligible for a Pfizer vaccine. That is, if they are Indigenous, if they have a specific underlying health condition, or if they're part of the National Disability Insurance Scheme. The government's expert panel on immunisations, ATAGI, has been looking at whether to expand the vaccine rollout to all young people in that age group. The Prime Minister says that he's expecting to receive that advice by Friday, so we should have an answer later this week. In the meantime, though, ahead of that decision, the man in charge of the COVID-19 vaccine rollout, Lieutenant General John Fruin, says that plans are being developed so that if and when that green light is given, the government can start rolling out those vaccines to children aged between 12 and 15 more generally.
We're working with the states and territories. I think school-based vaccination could be a big part of the program. Already some of the states and territories are moving kids like in year 12 to some of the big hubs. We're also looking at a program where we might be able to book families in so that parents and kids can get done together. So we're working a set of options at the moment that will give us the best opportunity to get all of those kids vaccinated as quickly as possible.
And Jade, looking ahead to Friday's National Cabinet meeting, this ongoing dispute over the plan to ease restrictions could dominate. Where does that discussion stand now?
Yeah, there's been a lot of debate this week about the plan, which was agreed to by National Cabinet, to start easing restrictions once we get 70 and then 80% of adults in Australia fully vaccinated. Some state and territory leaders have raised concerns about that in light of the scale of the outbreak in New South Wales, although the Doherty Institute, which was asked to prepare the modelling that plan is based on, insists that reopening can still happen safely once we hit those targets, as long as there are still effective public health measures in place like testing, tracing and isolating. The Federal Treasurer, Josh Frydenberg, is today urging states and territories to stick to that plan.
If we don't open up at 70 and 80%, then what is that number? When do our small businesses reopen? When do our kids go back to school? When do we go to the funerals and the weddings of loved ones? When do we move more freely across the country? We need to give people hope, and the plan based on the best medical advice possible does give us that hope.
Now, the opposition leader, Anthony Albanese, says that Labor does support that plan and the targets set out in it. He was pushed this morning on whether he should therefore be pressuring some of the Labor state and territory leaders to do the same. Mr Albanese, though, defended the rights of premiers to raise concerns, and he accused the Prime Minister of trying to pick fights.
I'll tell you what is incumbent upon national leadership. It's to bring the whole country forward as a united country, and not to try to divide. And Scott Morrison now is trying to distract from his own problems and his own failures by trying to divide the country, by trying to set state against state. And what the premiers have been doing is keeping their state safe.
Now, Joe, the Doherty Institute has been asked to tweak some of the assumptions in its modelling. The Chief Medical Officer has said that he's not expecting any major changes as a result, but that will also be discussed at Friday's National Cabinet meeting. OK,
Jade McMillan reporting there from Canberra. OK, let's head back now to checking out the COVID situation in the states and territories that get to the ACT now. More exposure sites added overnight. Reporter Lisa Glenday joins us now from Canberra. Lisa, g'day, what's the latest?
Good morning, Joe. Well, we're coming to the end of our second week of lockdown here in Canberra, and things aren't really where we had hoped they would be. Unfortunately, 30 new cases were recorded yesterday, and that is a record high during this outbreak. We now have a total of 167 active COVID-19 cases in the Canberra community. 4 people are in hospital. We know one Canberra woman in her 40s is getting breathing support in intensive care. We know that she wasn't vaccinated. Now, 25 of these 30 new cases are linked, which is good news. However, 5 are still under investigation. We know 11 spent some time infectious while in the community, and there are now over 400 exposure locations right across the ACT. The latest sites to be added today, we're seeing a day spa in Canberra's north and also a pathology clinic in Canberra's north, and they were added from a fortnight ago. Now, unfortunately, Andrew Barr says it's still too early to speculate as to whether Canberra's lockdown will be extended. We've got one more week to go. We are due to be released on the 2nd of September, but at this stage, I don't think the numbers are where the ACT government would like them to be, so we'll have to wait a little bit longer to find out what's happening with Canberra's lockdown, and of course we'll get an update on those COVID numbers from Andrew Barr at 11:45 today.
And Lisa, I think at one stage the ACT was at the top of the list in terms of states and territories where people had been vaccinated, but I think New South Wales has jumped ahead of us now. Where are the numbers at in terms of the vaccinations in the ACT now?
So we're going pretty well here in the ACT at the moment, pretty much leading the way. So we've got 60.7% of Canberrans who've now had their first dose, and almost 38% of Canberrans who are fully vaccinated. So that's some encouraging news. We're hearing a lot about these 70 to 80% targets, and Andrew Barr said yesterday that they are important milestones, but they certainly are not the end game. He said that the ACT is going to be aiming higher than those national vaccine targets, and he said the more people within the Canberra community that are vaccinated, the safer our community will be. But he said that is also going to protect the ACT from some of those decisions that are made by other governments, which is well out of the ACT's control. So at the moment, the vaccine rollout here is focused on the 30 to 39 year age bracket. People that are aged 16 to 30 have been able to register for a vaccine, but we know they won't be invited to book an appointment until September, and those appointments are likely not to be until October. So yesterday, the Chief Minister, Andrew Barr, was encouraging some of these younger people to consider getting AstraZeneca because of this wait that we're going to see. We're still waiting for extra Pfizer supplies. So he's saying young people should be considering AstraZeneca as soon as possible, and they should be talking to their GPs about that.
OK, Lisa Glenday reporting there from the streets of Canberra.